because yeah, the graphs that we see, the slides do. And this is just anecdotal. I haven't seen any figures really, apart from the slight rise in car journeys. But from people I've spoken to, some people have said to me, well, I'm fed up with this now. I'm not going to worry anymore. I'm just going to go out anyway. Or they just can't take it any longer. They've been stuck inside, and so they're kind of breaking the rules. 0345 6060 973. Dean in Swansea. Hello, Dean.
Good evening, Clive. How are you? All right?
I'm all right. Yes. What would you like to say?
I'm trying my best to adhere to the rules that the government are telling us at 5 p.m. every night. Stay home, protect lives, save the NHS.
Yep.
But it's twice now what's doing my head in. And the first occasion was on Wednesday, Prime Minister's questions. A Member of Parliament from Bradford was in Westminster. Now, is that an essential journey? Okay, so that's one tick in my box where I thought, well, if that's all right for him, it's all right for me to go out. And secondly, it's the clap for carers and NHS on a Thursday for the second week in a row. After the first week, Cressida Dick apologised for her officers being on Westminster Bridge doing all that clapping. They were there again for the second week in a row. Now, how dare they treat us, one rule for us, one rule for them? If we're all in it together, we need to be in it together, because at the end of the day, it is not happening, and yet again, it is really doing my head in, because I'm going through a divorce at the moment. I've not seen my children in about 9 weeks, as it is, without this lockdown. And if they can do that, and that geezer from Bradford coming down to Westminster, well, why can't I go to Lidl's?
Yeah. Yeah. Well, I'd say the answer is, on the Parliament point, first of all, I mean, they have made efforts, because I don't know whether you watched PMQs, but it was quite peculiar, because the majority of MPs were not there. They were on their Zoom webcams, but they had a representative sample. And so probably MP for Bradford was there as one of, I think, 50 that were chosen out of the 650. So I think they were there because probably being an MP is an essential job. Not everybody had to be there. They cut it down to only 50, I think it was, something like that. Well, it looked like less than that, actually. So I think that's reasonable, but I do agree with you about what I saw on Westminster Bridge. I mean, that's just blooming stupid. And I don't know whether you can blame Cressida Dick for it. It wasn't just the police, it was passers-by. They're all standing there in a crowd. And that's just plain stupid. Applauding the very people who they're putting in danger. So I completely agree with you there, Dean.
Cressida Dick, 7 days previously, apologised for the actions of her staff. And then 7 days later, 168 hours later, it happened again. Okay?
Yeah.
And
yeah.
Mr. Corbyn was in Parliament. Now he's in a vulnerable group, isn't he?
Well,
over 70?
I don't know about vulnerable, but he's certainly 70 and should know better. And he's been particularly bad at social distancing. There's been lots of pictures of him, even I think in a cafe in Westminster, sitting next to two other people when they'd spread all the chairs and tables out and he'd put them back together again, it looked like. I mean, he has been, I think he thinks that he's sort of showing how resolute he is, that he's carrying on with his political work and not taking any notice, but it seems, again, setting a really, really poor example. Dean, thank you very much for that. What's your view of all of this? Do you think that it is being taken seriously enough? Do you understand there are some people now pushing for at least some kind of relaxation? Do you feel that all this criticism of the government, that they should be talking about how to relax it? Should they be? Should there be a plan? Now, the argument is that gives people some kind of hope, something to look forward to, that eventually this is how it's going to work out, and they should openly talk about these ideas. But I don't know. I actually think they're being sensible. That the minute you start talking about we're going to relax this, we're going to relax that, then people start thinking, oh well, it's all working, we don't need to worry anymore. So I think they're right to take a firm line, but equally it's fine for us, members of the public, to talk about, and the media to talk about, well, what happens next? What about this idea? You may have seen it on the front page of a couple of newspapers. It, I think, originated in Belgium. It's supposedly under consideration that you could mix things up a little bit, that there won't be large events, but you could, say, have a group of 10 friends who you're allowed to meet. I mean, that raises all sorts of questions about who they are and where you meet and all the rest of it, but could something like that, do you think, should that be the next step? Or are you just hardline about this, let's just stick with what we've got? I mean, having seen the figures today, I'm not totally convinced. I'm sure that we're doing the right thing, but I'm not sure I'm seeing results yet. And if you look at the death rate, today's tragic death rate was surprisingly high, one of the highest on the graph. And I know there's a delay, but really, when are we going to start seeing those results? 0345 6060 973. 6:31 on LBC. Let's get the news headlines now with Glenn Tomsett.
Ministers have warned it's too soon to start lifting the lockdown. It's after the number of people in the UK who died in hospital after testing positive for coronavirus passes 20,000. Speaking at today's Downing Street briefing, Home Secretary Priti Patel said the entire nation was grieving as it marked another tragic and terrible milestone. She also urged everyone to continue with social distancing and to stay at home. Worldwide, the number of infected people is more than 2.7 million, with the death toll passing 195,000. Health officials here are urging us to continue to use the NHS as normal. A&E visits have fallen by nearly 50% this month over fears of catching COVID-19. And talks have been taking place between ministers and the Premier League on restarting the football season. The idea is to boost the country's morale once conditions for easing the lockdown have been met. The weather cloudy with some showers in northern areas, including Scotland and Northern Ireland. Mostly clear in southern parts of the UK with some mist and fog in the southeast. Lows of 3 degrees.
LBC. This is a message from the government about the emergency measures to support the economy during a period of disruption caused by the coronavirus. To help you, your business and your workers affected, you can apply for cash grants, business rate holidays, statutory sick pay relief packages, as well as the coronavirus job retention and self-employment income support schemes. For information, go to gov.uk/business-support now.
Have sore, aching muscles impacted you today? Voltarol Back and Muscle Pain Relief Gel is scientifically proven to help relieve pain, reduce inflammation, and restore movement. The anti-inflammatory ingredient gets to work where it hurts. Give it a try. What have you got to lose? Well, those sore muscles, I guess.
Voltarol Back and Muscle Pain Relief 1.16% gel contains diclofenac diethylammonium. Always read the label.
It's time for some truth. Time to settle once and for all that nagging doubt about whether you've been missold. If you've lost money on a stocks and shares ISA or investment bond sold by a bank as a claims management company, Goodwin Barrett could get to the truth and deliver you compensation. You could do all this yourself and refer to the Financial Ombudsman for free, but there are so many other things you may want to do with your time. So text SOLD to 78900. That's SOLD to 78900. Time for some truth.
Just because your child is at home, it doesn't mean they have to stop learning. Get My Grades is the ultimate online learning platform for all secondary school students, developing their English, maths and science skills with textbook content and exam-style questions. Right now, get your first month for just £1 using code RADIO, or the first 3 months free if you're an NHS worker. Visit getmygrades.co.uk. T's and C's apply, cancel any time or continue at £9 per month.
Leading Britain's conversation. LBC with Clive Bull.
LBC, I'm Clive Bull. I'm asking you whether you think social distancing is working. Are you prepared to keep up this? Well, it is an effort, I think. It maybe shouldn't be to just stay at home. That's what you're being told to do. Is the message clear enough? Is it working, do you think? 0345 6060 973. Would you like to see an easing of the regulations? If so, how? I think we all know that it's not just suddenly going to switch back to normal in 3 weeks, in a month's time, but possibly there'd be a graduated change. What change could you see happening? An easing up of the people you're allowed to see? I mean, I wonder how seriously people are taking that anyway. Are people meeting groups of friends? 0345 6060 973. And what about this work issue as well? When we talk about mixed messages, is it clear who should be going to work and who shouldn't be? Who is an essential worker? I mean, Transport for London, for example, here in the capital, they say this public transport is only for key workers. There are also other people who are going to work as well, who can't work from home. Are they key workers because they can't work from home? And are they working in an environment that is safe, socially distancing? I mean, building works are apparently starting up again. DIY stores, other stores. Are they going to be suitably safe? 0345 6060 973. Robin in Whitehaven. Hello, Robin.
Hello, Clive.
What do you think?
I think the government has given mixed messages right from the start on the social distancing, and it's getting more mixed as the days go on. I think at the beginning of the lockdown we had MPs, I think it was one Labour MP, one Conservative MP, went to visit the parents, which I'm sure will have an excuse or a reason why, but everybody who goes out will find an excuse or a reason why. And up in Scotland, I know Scotland's different to us, but I think it was one of the health officials, they were travelling to the second
Yes,
home.
went to the second home, yeah.
The Prime Minister, I think, is recuperating his checkers, and I think I read somewhere, could be wrong, that his girlfriend went to stay with him. Now, I'm sure there's plenty of other couples who are split up over this lockdown that don't have the privilege of travelling from one house to another.
No. Well, I mean, I don't know whether, I mean, he is the Prime Minister, and there's probably not much danger when both of them have had the virus.
I wouldn't imagine she'll travel by herself. I imagine she'd have to have a security detail with her and whatever else. I could be wrong.
Yeah, I don't know. Yeah, I presume so. Yeah.
I really think the government would give, like, the DIY...
How could they be clearer, though? Because, I mean, there is a case for saying that they don't want to be too authoritarian, because if you really lay down the law and say you must never do this, never do that,
I think
it gives people backs up.
I honestly think they need to be stricter with the rules. I think they need to be issuing fines to people outside. We've had, I think, forgive me if I'm wrong, I think we've had over 100 healthcare workers died. Now, these people go to work to save our lives. The least we can do is show some respect and try and help them out. I think it's moronic, absolute moronic behaviour of some people who don't stick to the rules. Because people go to work.
So you're not at all in the mood to start relaxing things then? This is not the time?
When you look at the death numbers today, I think it was 813. It's definitely not the time to start relaxing this. Absolutely not. And I think any idea of it is idiotic. I really do. It just put more strain on the NHS. There's doctors and nurses and care providers who go to work, putting themselves at risk. They have families as well.
But how long do we go on in this position, though?
Well, honestly, Clive,
I'm not convinced you can just carry on, regardless with this.
Well, I think you've got to try and get the numbers down before you even contemplate with the number of people dying.
Okay, well, which is, to be fair, that's exactly what the government are saying. They've been very clear about that. That is one time when they actually have been clear. They're not saying we're looking at easing things at all. And I'm glad they're not. Robin, thank you very much. 0345 6060 973. Adrian in Herne Hill. Hello, Adrian.
Yeah, hi Clive, how are you?
Hi. Yeah, I'm all right. What do you think about this?
I was saying to your colleague, I was in Brockville Park today. That was the one that was in the news a few weeks ago.
I know it well, yes.
And it was busy enough. It was bang busy enough. I mean, I just went for my little walk, but no, there was lots of people. So, I mean, but the balance against sort of, I'm speaking to someone who's basically more or less lost my business, but I've changed my mind. The balance against looking after I think 99.99% of people are taking it, you know, completely seriously. But I think once summer kicks in, you're going to have a serious problem keeping people indoors, especially sort of. I mean, I live in South London. You know, not everyone's got a garden. You know, it's
No. Well, people have told me who've been into Brockwell Park that it is full of people not following the rules. They're lying there sunbathing, they're gathered in groups, they are absolutely not social distancing.
Yeah, I saw that today. Yeah, without question. But I mean, it's not. I think everyone's trying to do their best. I mean, they're fighting an enemy that's not very cordial. But you know, you've got to. I mean, I've got a brother in hospital at the moment who's very, very poorly. You've got to take this seriously. You've just got to do. And you know, I agree with the last caller in that I think the government have been giving mixed messages, setting dates, and people thinking, yeah, we're going to get cut loose. They shouldn't be doing that. One person I trust is the head of the National Health Service. I can't remember his name. If you don't listen to him, you're completely stupid. It's just,
Well,
you know.
I wonder if they're doing it bit by bit though, because psychologically it affects people. If the government came out and said, look, we're going to have to level with you here, you're going to be in lockdown for the next 6 months, I don't think that would have a good effect on people's sort of mental health and general well-being, would it? So maybe by saying, well, we're going to have another 3 weeks, and then, oh, well, there might be another 3 weeks after that, it sort of manages people's expectations.
Yeah, okay, but well, I mean, I think you've got to be a bit fierce in that to say.
Really?
I mean, I mean, if you're not supposed to be out and about, if you're not supposed to be using public transport, just don't. And if you are, then you know you should get in trouble for it because it's not okay. It's not okay.
It's not okay. No, well, it's not. If you're making a train more crowded than it should be, that is absolutely not okay. And some of the London trains are worryingly busy. When you went for your walk in Brockwell Park, then,
Yeah.
did you manage to socially distance? Because I find I'm walking around South London, trying to get a bit of exercise, and there's so many people walking and jogging and cycling, you can't keep 2 meters away from people.
No. I mean, you know, with the best will in the world, you can't. But I mean, you know, you can't. I mean, I live on my own. You talk about mental health issues. So, you know, it's horrible. But I haven't seen my kids for 6 weeks. But I'm sticking to the guidelines because you know you got to believe the national health. I mean, this thing's terrible. You know, no one knows where this is going. I don't think. And you've got to listen to the medical people.
Yeah.
That's what I think.
Yeah, I mean, you're right. Thank you very much, Adrian. Nobody does know. I mean, I think the glimmer of hope for us all, really, is that there is some evidence that this social distancing does work, and it gradually goes down. I don't know whether we can entirely believe what's happened in China, for example, but they've pretty much eradicated it from a huge peak. So there is some evidence that it will work. And that's maybe what we've got to look forward to, but let's not be premature about it. Adrian, thank you. Darren in Port Talbot. Hello, Darren.
Hi, how's it going, man?
All right. How's it in Port Talbot?
It's okay. Just a message to Dean in the last caller as well, as I was listening. You within a reasonable amount of distance, I believe legally, if you have a court order, to be able to pick up your children for visiting for contact. I believe that I don't want to go on this, but this is just a guideline. Maybe they want to.
That you can,
but you can do that. So you know.
But it may be that yeah, that's a very good point. I'm glad you mentioned that. It may be that just for safety's sake, he doesn't want to see
just for safety's sake, but legally,
you know, well, I've got grown-up children, but I haven't seen them for 6 weeks either. Because when it picks up households.
But just basically, I do believe that separated parents are able to. I don't know. I just check it. But
okay, well, that's worth looking up. Yeah. Thank you, Dan.
But anyway,
Yeah.
basically, as far as what key workers or businesses are concerned about opening up, my first point is basically, where are we going to get to a point with mixed messages that unless you can't work from home? So,
Yeah. What does that mean?
a shop worker, as a shop owner, can't work from home. So, is it going to get to a point where she's going to say, well, I'm allowing 3 or 4 people into my shop, whether it be a clothes shop, whether it be a non-essential shop, basically. Am I going to be able to carry on with those rules? Because I'm not...
What is an essential shop and what's not an essential shop?
Well,
Is a
obviously it's not.
DIY superstore opening, is that an essential shop?
I don't believe so, Matt. I don't believe so. I know that a lot of people are doing DIY, but a lot of people that do DIY cause themselves harm and end up in A&E. So there you go. But I mean, as far as I support the lockdown as far as that's concerned. As far as the lockdown is concerned, and how is people and how are people observing it in my area? Unfortunately, they're not observing it at all. I'm a key worker. I'm called a key worker. So I go to and from work every day, and I come back and I see people playing football in the fields. And these aren't kids; these are grown men. I see people having barbecues with more than about 10 people there. They're obviously not from the same household. The attitude is, do you have a cough? No. Do you have a temperature? No. Okay, come round for a barbecue. That's the mentality that I'm seeing. And I'm going to work, and these people have probably been furloughed, and my taxes are going to pay for them to have barbecues.
Yeah.
And I see people.
Putting you in danger.
Yeah, I see people falling out of takeaways that have been just basically on the Browns and list all day, okay, because they haven't got a job to go to, and I'm queuing behind them after being in work all day to supply their service.
These little takeaways, I mean, do you think they're essential? They're food places.
They are very essential.
Really?
They're very essential to me because I've had a delivery today. Obviously, social distancing.
You have it delivered?
I've had it delivered tonight. Normally, I would go to the takeaway on my way home. I decided
How
not
safe
to.
do you feel at the takeaway? If you don't mind me asking, if you're queuing up at a little shop, and those takeaways are little, do you feel safe? Are people 2 meters apart? They can't be.
Yeah, they're only allowed 2 people in the takeaway at a time.
Right. And what about the person that's serving you?
Exactly. Unfortunately, tonight is my last shift today, so I thought I'm not going to cook tonight. I'm just going to get myself a takeaway, and I got myself a takeaway, but it was delivered. But there's nothing I can do. But I mean, what I'm saying is, I see these people that are the people that are flouting the rules are the ones that are being furloughed.
Well,
the ones that aren't being forced
Do you think
to
it's a
go to
little?
work.
It's probably a minority, though, isn't it? I mean, it's probably what,
Oh yeah,
5%.
I mean majority. But I mean, I don't see in my area in Port Talbot, and I haven't seen it really going from Port Talbot to Swansea and back again. I haven't seen a lot of particular police checks. I haven't seen a lot, so I don't know.
Seems
I
like
mean,
they'd have their work cut out.
Port Talbot is Port Talbot. No one comes in and no one leaves, mate. It's one of those places. It's like
They're all having barbecues. All right, Darren, thank you very much. It's not working in Port Talbot, according to Darren. What do you think? 0345 6060 973. It seems like there's a bit of a divide. If anything, I mean, the balance of calls coming in, and we'll look at some texts in a minute, the balance of calls seems to be that you feel it should be tougher, that the government should be even more tough in its instructions. I wonder if there's anyone listening who feels that really it's time to relax things a bit more, and how that would work. We're going to talk in the next hour particularly about the effect on business, and I want to hear from people who are running a business and how it's affected you. 0345 6060 973. More in a moment. This is LBC.
Here at LBC, we want to say thank you to all our key workers.
I'd like to thank all the NHS and all the frontline workers out there that are doing their very best. Can't say thank you enough.
There's simply inadequate words to be able to thank all of our NHS and the care staff right the way throughout.
It's me.